Hi, my name is Dr. Madison Oak, and today we are here to talk about how to use something called a Brock string. So a Brock string is really simple, easy to make or easy to find. You can buy them on Amazon or find some string and some beads that your kids use. It's basically just a string with 3 different colored beads on them. Now you can move these kind of anywhere along the string that you'd like. Mine is a couple feet long, nothing crazy, doesn't have to be super long, and we are going to learn how to use it today. So first, you want to consult with your vestibular or regular physical therapist or other therapist who's going to help you with your vision, and see if you have a convergence or divergence deficit, or if you have any difficulty with looking really close and then really far. If that is something that is difficult for you, then this might be a good exercise for you. So what you're going to do is hook this somewhere where it's about eye level or below eye level. So you can tie it basically anywhere you'd like. I usually use a door handle or, of course, a bedpost. And what you're going to do is put these 3 beads, 1, 2, 3, at different distances from each other. So I have one here, I have one here, and I have one here. Now, if I turn and look and put the tip of my nose at the end of this string, I can see all 3 in my line of sight. Now, depending on where me and a patient have decided this should be is where we place these. So one should be pretty difficult, easier, and maybe even easier depending on where your deficit is. You can kind of determine this with your physical therapist. Now, if these 3 are for me getting closer to my nose, if convergence or my eyes coming together is harder, then we want to put this closer one closer. But if looking at a distance in converging is more difficult, maybe we need to focus on that. Regardless, put them in a place that maybe is easy for you at first and then work up to something more difficult. So what I'm going to do, since I have my pink, green, and purple beads, is I place this at the end of my nose, and then I stare at this pink bead. Now I only see 1 pink bead here, but I see 2 and 2 of the green and the purple. This is exactly what is supposed to happen. It should look like this for me, like this. So I see this one close to me, and then as it goes out, it goes into this V shape. Next, I can do the same thing, but I can look at the green one. So I have my pink one here, I have that upside down V going out, and then now when I look at the green one, I see 1 green dot, 2 pink dots, and 2 purple dots. So now I see an X in my vision, and that is exactly what's supposed to happen. Next, I can jump to my far purple one, and there's 1 purple, 2 greens, and 2 pinks. They're not as perfect of vision. Of course, it's not as clear as the purple one is, and it shouldn't be. That's normal. But I should be able to see both strings on both sides, both green dots on both sides, and both double pinks. It is really important that you can see all of this. If one you cannot see or is blocked, it can mean a couple of different things for you and your vision. So it's really important that you know what that means, and that you work with a vestibular physical therapist, a vision therapist, or a physical therapist who knows how to do this for all of these exercises. Again, this is for convergence and divergence, so you can hop back and forth, hold close, hold far. Whichever ones are the most difficult for you are the ones that you should be doing on a regular basis in order for you to get better at this overall. I hope this was helpful. I hope that learning how to use a Brock string is helpful. Remember, the close one should look like a V, the middle one should make everything look like an X, and the far one should look like an A coming at you. All right, I'll see you in the next video. Bye.